Hello and Assalamu alaikum. Welcome to Scan Diagnostics. Here, this is the CBCT of the patient which you had requested. The area of interest is the maxilla or the maxilla, the upper right and left areas for implant placement. Now, moving and focusing on the lower upper left side first. This is the upper left molar. It is ghastly carious. We've got a chamber opening situation with the periapical radiolucency. If this tooth is extracted, the ridge width is 12 millimeters and the height is 10. This definitely can receive an immediate implant. Moving to the region of the upper 6, we've got very thin ridge here, not sufficient for an implant, 6 millimeters of width with 14 millimeters of height, and at a very D3 quality bone. Moving to the upper left 5 region, again this area has a radiolucency, 9 millimeters of width and 16 millimeters of height. Moving to the region of the 4, we've got a PDR ridge width of 8 millimeters and 19 millimeters of height. In the canine, we again have very thin ridge here. We've got only 6 millimeters of width, 20 of height, and only 4 millimeters of width in the mid crest region. This is the lateral incisor. The lateral incisor is also doing very well. Periodontally compromised, but this seems like it has crown cutting done. 6 millimeters of width with approximately 15 millimeters of height. The central incisor also seems crown cutting, no bone support, so approximately just 7 millimeters of width, just 4 millimeters of width mid crest, and approximately height of 17 millimeters. This is the central incisor on the top right side, again very periodontally compromised, 7 millimeters of width, 18 millimeters of height, and 4 millimeters of mid crest width. This is the lateral incisor on the top right side. This lateral incisor is also concurrent and good bone support. Moving to the canine on the top right, this canine also has a cavity. There we go. We presume it might have a chamber opening, but a cavity, good bone support. 9 millimeters of ridge width with 18 millimeters of height. On the top 4 region, again we've got very compromised bone width, approximately just 3 millimeters of width with 18 millimeters of height. Moving to the region of the 5 and 6, we've got an approximately ridge width of 7 millimeters and a height of 12 millimeters. And then moving to the second molar region, we've got approximately 8 millimeters of ridge width with 6 millimeters of height. And this is how the implants, these are the only places where implant placement is possible. The upper anterior region, especially the central incisors, implant placement is not possible.